Hello and welcome back to Unacademy. So let's crack NEET PG. Myself, Dr. Muskan Chaudhary, and today will be a short session. We'll cover about the MCQs, the important MCQs that has been previously asked in the INICET examination, that is the AIMS examination. All right, and first talking about the Unacademy, we know that Unacademy is the India's largest learning platform, and with this we get about we get access to both the live and the recorded sessions, and specifically beneficial for those students who are the periphery and who are the medical officers and who are doing the JR-ship and they do not get much of the time of to watch the live sessions can actually watch the recorded session. That too, learning from the India's topmost educators. Unacademy has the topmost educators from all over India who are teaching on the Unacademy platform and working day and night to help you guys to prepare for examinations and to compete in the T&Ds, the T&Ds that are testing discussions and the quizzes that are regularly being taken down by the Unacademy platform for to help you evaluate, to help you analyze your performance for the examination and to make your stamina for the examination, because it is examination of 3.5 hours and it is quite impractical if we don't practice it at home. We actually we are unable to practice directly in the examination to do the examination. We can study on the device anywhere and everywhere and assess around 25,000 of the MCQs. Around we have to cover about 18,000 of the MCQs for the NEET PG examinations and covering about 40 to 100 of the questions every day. So we need to cover around 18,000 MCQs, and the Unacademy has a bunch of important questions from the all the high yield question, high yield topics. Soon the printed and the digital notes are being given by the Unacademy, and before 11th of September they were mainly given with the plus platform, but now they are given with the icon subscriptions, and you will be accessible to access your recorded classes along with the printed notes. All right, Unacademy has come together with that of the Prep Ladder, and as we know, Prep Ladder is one of the topmost institutes on the coaching platform. When we talk about the rapid revisions and the treasures and the dream notes that are being provided by the Prep Ladder, along with the video lectures and the clinical and the integrated essentials and the QBanks, right? With along with the well-structured live batches of the Unacademies and the T&Ds with 25,000 MCQs and the comprehensive and printed digital notes that are being provided by the Unacademy platform. 4 year subscriptions is mainly beneficial for the second and third year professional examinations giving students, and they have a bunch of the time so they can take down their time to come to clear down their basics and help them evaluate their performances. All right, and there has been a price hike from the 1st of the October, and for 4 subscriptions it will be around 65K, and for Iconic it will be around 75. 75K. All right, and along with this, with 12-month subscriptions, you will get 12 month subscriptions, you will get 2 month subscriptions totally free, and with 24-month, you will get 4 month subscriptions totally free. All right, prices will be rising from the 1st of the October, has been rose from the 1st of the October. For 1 year, it will be around 52,500. For 18 months it will be 57,500. After for 2 years it will be 65,000, and for 36 months it will be 75, and for 48 months it will be around 85,000. You can use my code, that is Muskan 10, to get 10% of the discount. Okay, and please subscribe before prices go up, and it is mainly for the October sessions because there's a hike in the October from the October. All right, that is from rising from the 1 year from 52,500, and you can use my code, that is Muskan 10, to get 10% of the discount. So this will be question and answer session round, and we shall start with the first question. I'll give around 15 seconds for every questions. According to the Transplantation of the Human Organ Act 1994, what is the punishment of a doctor What is the punishment of a doctor who is found guilty? All right, that is whether less than a year, less than a 2 year, 2 to 5 years, and more than 5 years. All the questions that we are going to discuss are the aims questions that has been asked in the aims examinations. All right, so starting with the first questions, and your time starts now for 15 seconds. Just take your time and just let me know the answer. So what will be answer? The answer will be what? C, that is about 2 to 5 years. All right. So coming to the answer now, 2 to 5 years. If a doctor is found guilty of an unauthorized removal of a human organ, if he is found guilty of removing a human organ or doing any commercial dealings with the organ of the person, right? He can be punished up to what? Up to 5 years with the fine of around 10,000 rupees. All right, and removal of the name from the register of the State Medical Council for 2 years for the first offense, and permanently if is found for the subsequent for the same offense. But with the 2011 amendment, the punishment has become imprisonment up to 10 years with the fine extending up to 20 lakh rupees and the removal of name from the register from the State Medical Council for a period of the 3 years for the first years and permanently for the subsequent. So now the rule has been modified and it has been extended up to what? 10 years and 20 lakh fine along with the removal of name of the person from the state medical council on the subsequent offense. Right, now comes the next question. An elderly man has presented with fever, dry cough and the chest pain. The causative organism was detected in sputum which is cultured on the charcoal yeast medium. The organism is Haemophilus influenza, Moraxella legionella or Burkholderia capriccia. So, giving 15 seconds for the question, just let me know and type down the answer below. So, the main catch of the question is he is what growing on what charcoal yeast media. So, what we have to do, we just have to find the organism that is growing on the charcoal yeast media. All right. So, what will the answer? The answer will be the Legionella. All right. Why? Because the Legionella infection, the Legionella, it grows on the media that is BCYE, that is buffered charcoal yeast extract agar, or it having got amino acid and the vitamin supplements that is favorable for the growth of what Legionella. So it is used for the growth of the Legionella, that is a BCYE media that is used, and it meets the acidic condition optimal for the Legionella growth. The isolation of the large negative rods on the BCYE after 2 to 5 days that have failed to grow on the routine media is presumptive evidence of the Legionella because it is what requiring what the yeast extract along with the additional supplements. Now this is the BCYE, that is buffer charcoal yeast extract media, that is the selective media for the growth of what Legionella, that is a buffer charcoal yeast extract. Right, and the next option, what we one option was the H influenza, and we know that it requires what? It requires the chocolate agar that is containing what 5 to 10% of the sheep's blood that has been heated to 70 degrees Celsius because it releases factor number 5 on the lysis of the RBC, and the factor number 5 or factor number 10 is required for the growth of the H influenza growth, and they show what? They show the gray convex growth on the media. Okay, so H influenza, it is going on the what? It is going on the chocolate agar. Now coming to the next option. Now, coming to the next option, that is Moraxilla. We are talking about Moraxilla. They are what large negative diplococcus, and they are fastidious organisms that are non-motile, and they are the human pathogens that affect what the upper respiratory tract and cause also can cause the infections in the ear. It is the third most common cause of the otitis media, and it is immunocompromised hosts. They are susceptible to the infection. They can also be cultured. The key point is that they can also be cultured on the blood agar or the chocolate agar. Now, coming to the laboratory diagnosis, colonies on the chocolate agar will appear. What colonies on the chocolate agar? On the chocolate agar will be what? It will be they will be showing the scoot across the media, right? That is the colonies pushed into the loop. They will scoot across the media. All right. What are the other medias that we are using for the Moraxella? We read key one is the blood agar and the modified that is the on eating the blood agar that is the chocolate agar and the Thayer Martin media which is also used for the growth of what? Which is used for the growth of what? Neisseria. Alright, for the growth of what? Neisseria and chocolate agar particularly used for the growth of what? H influenza. Okay, now coming to the next option, one was the H Haemophilus influenza that we are talking about. One option was that now one remember that Haemophilus ducreyi it actually shows the appearance of the school of fish appearance or the railroad or tram track appearance or the railroad appearance under the microscopy. This is a H influenza on the chocolate agar that is showing what the smooth convex growth. It is due to the lysis of the RBC that is releasing what factor number 5 that is required for the growth of H influenza. All right. Now, what is the clinical syndrome? Clinical symptoms. One is the meningitis, otitis. That is, you need to remember, it is by the type B. That is why meningitis, and the epiglottitis is also by the type B. Why otitis media is non-typable. H influenza by the non-typable. Alright, so meningitis, sinusitis, otitis media, epiglottitis. Apart from this, the bacteremia and the pneumonia that is being caused by the Haemophilus influenza. Just remember meningitis by type B and otitis media is by non-typable Haemophilus. Okay. Now, identification of the Burkholderia capicea complex. It is showing the variable complex colony morphology, and selective media is not selectively enough. And what is that? Capicea media, that is the BCSA media that is used for the growth of the culture of the Burkholderia capicea. Now, coming to the next question, which is not true with regards to antibiotic resistance in the bacteria. What is the most common mechanism is production of the antibiotic destroying enzymes, lack of the target binding site will mechanism of the resistance, some enterococcus against vancomycin. Plasmid mediated resistance is transmitted only vertically, and target binding shifting is a mechanism in some pneumococcus. All right, so just taking down your 15 seconds, we'll discuss the answer for this. So whatever the answer, even if you doesn't know about the A, B, D, you can just check out what is option number C is saying. That जहाँ पे word आ जाए only, then you will have to make yourself forced to think about that option. That plasmid mediated resistance is transmitted only vertically. No, it is not possible. It is transmitted both vertically as well as horizontally. ठीक है, horizontally अपन कैसे transfer करते हैं? We transmit it with the help of the conjugation, जहाँ पे plasmid factors are transmitted from one bacteria to another. Alright, apart from just transferring from the vertically, the horizontal transfer is also possible. So plasmid mediated resistance is transmitted both vertically as well as horizontally. Okay, so route of the horizontal transfers that we talked about are the one is the one of the most important, that is the conjugation. One is the transformation, and in that, even in the transformation, also the fragments of the plasmid are transferred from one bacteria to another bacteria directly from the environment. So DNA can also be transferred from the transformation as well as the plasmid. And next is what? Transduction. Okay, these are the three mechanism of the drug resistance. Now production of the beta lactamase, it is the one of the, it is the most common mechanism for the penicillin resistance in both the gram positive and the gram negative. That is the production of the beta lactamase enzyme, that is breaking down the beta lactam chains in that of the beta lactam antibodies. So it is actually, and another mechanism is alteration of the penicillin binding proteins, that is seen in where gram positive bacteria. This is the basis of for the MRSA, because here the drug of the choice, what is the drug of the choice in MRSA is what? Vancomycin. Is what? Vancomycin. Why? Because it has acquired the resistance against the penicillin. Alright. Impaired penetration seen only in the gram-negative bacteria. PVP are localized on the outer surface and not on the cell wall. They are essential for the synthesis of the cell wall. So what are the mechanism of the penicillin resistance? One is the formation of the beta-lactamase, and another is the alteration of the PBP and the impaired penetration. Alright, now coming to the next question, that is the, with reference to the Bacteroides fragilis, the following statements are the true. Okay, Bacteroides fragilis is the same frequent anaerobe isolated from the clinical samples. It is not uniformly sensitive to metronidazole, and the lipopolysaccharide formed by the fragilis is structurally and the functionally different from the conventional endotoxin. The shock and the disseminated intravascular coagulation are the common in the Bacteroides bacteriemia. So take your 15 seconds and just let me know the answer. So what is being asked, the exception is asked with reference to bacterial specialists. The following statements are true except. Alright. Option D is not true in this case, right? Now, when we talk about the bacteroids fragilis, when we talk about the bacteroids fragilis, okay, bacteroids, they have what? Lipopolysaccharides. They have what? Lipopolysaccharides, but they do not have the endotoxin activity. That do not have the endotoxin activity. Okay, so they are what? The gram negative, that is having what? The lipopolysaccharides, but they lack the structures with the endotoxin activity. Lipopolysaccharides having three components, that is O, C, and A is having what? Endotoxin activity. We read this in about the cell wall structures. So they do not have the endotoxic activity, and the lipopolysaccharides of bacteriophages are much less toxic than those of the other gram negative bacteria. Therefore, the infection that is caused by the fragilis, that doesn't directly produce the clinical sign of the sepsis or the shock, because they are not having endotoxin activity. When these clinical signs appears, they are a result of the inflammatory immune response only. So when we check about the option D, that is shock and the disseminated intravascular common, they are common. They are not common. They are uncommon in that of the fragilis. ठीक है, प्लीज रिमेंबर दैट बैक्टीरियल fragilis में although it is a gram negative and the gram negative does have the outer membrane जिनके पास LPS होता है और LPS में endotoxin activity, but it doesn't have the active LPS with the endotoxin activity. ठीक है, so these do not directly produce the clinical signs of the shock and of the endotoxin, right? So it is Bacterius fragilis is actually causing the endogenous mixed anaerobic infections, and you can see the lesion in the foot of a diabetes patient. Now, coming to the next question, a young male patient presented to OPD with the urethral discharge. On urine examination, pus cells were found, but not the organism. Which method would be best for the culture? So, at 15 seconds. Now, what we are talking about on the urine examination, pus cells were there, but not the organism. So, which method would be best for the culture? Now, when we talk about the urethral discharge, there are two types of urethral discharge. One is the gonococcal and the non-gonococcal urethral discharge. And for the non-gonococcal urethral discharge, what is the most common organism? Is what chlamydia. Okay, that is the chlamydia. And for the chlamydia, what is the culture media? It is the McCoy cell lines that we use for the chlamydia. Now, the key catch point here is that he is saying that on urine examination, pus cells are found, but not the organism. So we are talking about the non-gonococcal urethritis, and what is the media that is for the growing the culture, showing for the culture. That is McCoy cell lines in the urine examination is a patient of the urethral discharge, only the pus cells, but no gram negative diplococci suggests that non-gonococcal urethritis. Okay, and the most common cause of the non-gonococcal urethritis is chlamydia. Okay, and what is the culture media for the chlamydia trachomatis? Is what? McCoy cell lines. Okay, now McCoy cell lines are the culture media for the chlamydia. For the Neisseria, we know Neisseria gonorrhea, Neisseria meningococcus, it is what? Thiamidin media. Right, and for the PPL, it is PPLO, it is what? For mycoplasma and cooked meat media. Now, what are the organisms that are causing the non-gonococcal urethritis? Non-gonococcal urethritis. What is the most common organism? Is what? Chlamydia. Other than this, the Gardnerella and the Vaginalis, Ureaplasma urolaticum, Candida albicans, Mycoplasma, Trichomonas vaginalis, and the herpes and other. Now, coming to physiology, chlamydia trachomatis image is very important. Please remember this image that you can see the chlamydia trachomatis inclusion bodies on the McCoy cell lines. These brown inclusion bodies, these are nothing but they are the inclusion bodies of the chlamydia trachomatis on the McCoy cell cultures. Now, these are the clinical syndromes caused by the chlamydia trachomatis in the men. It was conjunctivitis, urethritis, and the prostatitis. And the woman, the conjunctivitis, urethritis, cervicitis. Complications leading to Reiter's syndrome and the epididymis and endometritis and the salpingitis, perihepatitis. All right. Now coming to Neisseria gonorrhea, we know that what is the culture media? It is what? It is Martin media. That is the for the growth of the Neisseria gonorrhea, and the PPLO growth, that is for the growth of what? Mycoplasma. That is PPLO. That is having what? Penicillin, polymyxin, and the amphotericin. This is Robertson cooked media broth. This is Robertson cooked media broth, that is for the growth of the anaerobic culture media having what? Having what? The beef particles, beef meat particles, that is having what? Glutathione. Glutathione, that is having what? Glutathione, that is a reducing agent and will utilize of the oxygen, creating the anaerobic media. Creating what? Anaerobic media. Now, coming to the next question, bacteria coated with the complemented IgG phagocytosis is enhanced by receptor-mediated pseudopode formation, myeloperoxidase, or the C3b Fc-mediated destructions. So, take down your 15 seconds. Okay, so what will the answer here? So bacteria coated with the complement and the Ig immunoglobulin. So we are talking about phagocytosis is enhanced by this is an indirect definition of what? Opsonization. And that is enhanced by what? C3b and Fc mediated destruction. Now, C3b and Fc mediated destruction, here the examiner is simply asking about opsonization, that is coating the bacteria, because we know that C3b and C4b, they are what? They are what? They were or acting as a opsonin. They are acting as an opsonin that is covering down the bacteria and attracting the cells for the destruction of the bacteria. So they are what? Enhancing the phagocytosis. Alright, so this phagocytosis speed can be increased by bringing into action the attachment devices that is present on the phagocytic cell, that is Fc receptor, which binds the Fc portion of the antibody molecules, chiefly IgG complement receptor, which binds the third component of the complement, specifically C3b. So, what are the factors that are enhancing the opsonization? That is, we know that is binding with the Fc portion of the antibody, and इसके अलावा mainly which antibody? That is the IgG antibody, C3b, and the complement receptor. This coating of the organisms by the molecule that speed of the phagocytosis is termed as an opsonization, and the Fc portion of the antibody and C3 are what? They are nothing but they are what? Opsonins. All right. Now, moving to the next question. This is the last question of the short session that we took today. A 5-year-old child from the rural area presented in the OPD with the pustule lesions to the lower leg. The culture from the lesion showed what? Beta hemolysis colonies on the blood agar, which were gram-positive cocci. Which of the following reactions helps to provisionally confirm the diagnosis of streptococcal pyoderma? It is optogen sensitivity, bexytracin catalase, and the bile solubility. So the question we are talking about the beta hemolysis, right? In the streptococcus, it is what three types of hemolysis: alpha होता है, beta होता है, gamma. Gamma is no hemolysis. That we are talking about the enterococcal and the non-enterococcal family. ठीक है, and alpha and beta is including the subgroups, that is ABCD subgroups, that of the beta hemolytic streptococcus. In the alpha, that is the green zone of the hemolysis, we are talking about the Streptococcus viridans and the Streptococcus pneumococci. Okay, so we are talking about, but here the lesion is showing what? The beta hemolytic colonies. We are talking about the beta hemolytic colonies, and mainly we talk about the two groups, that is the A and the B group. B group is having Streptococcus agalacti and A is having Streptococcus pyogenes. Okay, they are further be differentiated on the basis of what? Basic sensitivity. Okay, that is further be classified on the basis of the basic tracing sensitivity. There is gram-positive cocci with alpha hematopoiesis, Ashipaga, Streptococcus pyogenes, and the Streptococcus pneumoniae, and they can further be differentiated when we talk about the alpha. They are further differentiated on the optogene sensitivity. All right, because we talk about the viridans, we remember it by mnemonic overpass. That is optogene sensitive, viridans is resistance, and pneumonia is what? Sensitive. While we talk here about the bacitracin, that is pyogenes. Pyogenes is bacitracin sensitive. We can remember this S is coming. So it is what? Bacitracin sensitive. And A galacti is what? Bacitracin resistant with positive CAM test. Okay. Anthracoccus, that is having the biosolubility. Okay, so remember one mnemonic is the overpass and the pyogenes S4 is sensitive for the bacitracin and A galacti is positive for that of the CAM test. This is the bacitracin sensitive, that is sensitive for Streptococcus pyogenes. Identification, they cause a variety of disease as Streptococcus pharyngitis, sore throat, and Streptococcus skin infections, that is impetigo or pyoderma. That is, we are talking about beta hemolytic streptococci, that is group A and the group B, that is causing pharyngitis, it is causing sore throat, it is causing scarlet fever, impetigo, and the pyoderma. All right, so this was a short half an hour session about INICET examination, the questions that has been previously asked. More questions we'll discuss further in the next class. So the remaining of the questions we'll discuss in the next class because only it is around 15 to 20 questions that I took and due to some emergency duty I'll have to rush back. So we'll discuss the remaining of the questions in the next session, and please do use my code, that is Muskan10, to get 10% of the discount, or enrolled into the any of the examination preparation or for any of the competitive exam. You can just use my code, that is Muskan 10. All right, and there will be examination, there was scholarship paper that is conducted by the Unacademy on 10th of October at 11 p.m. and sharp by just keep a reminder and do give the examination, because this is something that is you must attend and you must give a shot.